Hello and welcome back to another video. Today we will be looking into a topic that a lot of you guys have been requesting me to do. And no, it's not the Macbeth iceberg. Today we will be talking about a topic that many pet owners may have never even heard about. And that is the correlation between gonadectomy and conditions of both neoplastic and non-neoplastic character in dogs. Blah, that's a mouthful. For the purpose of this video, gonadectomy basically means a neuter or a spay, and neoplastic means cancer, and non-neoplastic means not cancer. So you may be asking right now, why are we talking about this? Well, one of the most important decisions a pet owner makes is whether to spay or neuter their dog. In many places like the US and Europe, gonadectomy is performed on most pets in order to regulate their domestic dog population. According to a 2019 study, around 69% of the US's dog population is fixed. Spaying and neutering can also be done to correct inappropriate behaviors. This is predominantly seen in males and is termed the law of the testicles. The male testes produce a lot of testosterone after reaching sexual maturity. Increased levels of testosterone can lead to behaviors such as mounting, peeing to mark territory, and aggression. Some dogs will even put themselves in danger if they sense a female in heat. Due to this added nuisance, many owners elect for a gonadectomy early in life to avoid these behaviors. Lastly, dogs are also prone to cancer involving the reproductive organs. This is why crypt orchid dogs are neutered a lot of the time. So with all of this considered, clients tend to elect for the surgery. But with all surgeries, there are inherent risks, like botching a plastic surgery. So let's take a deep dive into the negative impacts that a gonadectomy can have on your dog. First, let's start off with the neoplastic conditions that are more commonly seen in gonadectomized dogs and bitches. Doing research into the topic, I found a whole laundry list of correlation studies that suggests that a spay or neuter can increase the incidence of different types of cancer. So let's just go down the list and see what types of cancer we're dealing with here. First up, we have prostate adenocarcinoma, with adeno meaning gland, carcin meaning cancer, and oma meaning tumor. So in the normal and healthy male dog, there is an accessory sex gland known as the prostate gland. This secretory gland is located along the male reproductive tract and is responsible for producing citric acid, lipids, and enzymes that increase sperm viability. However, due to its location, it can cause a ton of problems when it becomes neoplastic. The prostate is close in proximity to the urinary bladder. Thus, when it becomes enlarged, it obstructs the flow of urine. This can lead to a whole cascade of urinary problems for dogs with this condition. Unfortunately, prognosis is pretty bleak for this type of cancer, as high rates of metastasis are observed in dogs. Next, we have transitional cell carcinoma. Neighboring the prostate gland, the walls of the bladder and the urethra are lined with what is known as transitional epithelial cells. This type of epithelium allows these organs to stretch when full and distend when empty. However, these cells can become cancerous and lead to the same symptoms as the prostate cancer. These include straining to urinate, bloody urine, and increased urination. Also like the prostate cancer, transitional cell carcinoma has a poor prognosis in dogs. To add insult to injury, we have osteosarcoma, with osteo referring to the bone and sarco referring to muscle. Osteosarcoma typically affects larger breed dogs and manifests as a tumor on one of the limbs. This itself can cause pain, lameness, and bone fractures. Unfortunately, the survival rate is very low with dogs, typically dying from lung metastases, meaning that the cancer migrated to the lungs and caused physiological obstruction. Next up on the list is hemangiosarcoma, with hemangio referring to blood vessels. While having the potential to develop anywhere in circulation, this type of cancer typically forms around the heart and the spleen. A study, which we will take a deeper dive into later, found that spayed bitches were twice as likely to develop splenic hemangiosarcoma and 5 times as likely to develop cardiac hemangiosarcoma than non-spayed bitches. This cancer is often fatal and also typically impacts larger breed dogs. Going down further, we have mastocytoma. This type of cancer originates from the mast cells in the skin, which are a type of immune cell that reside in bodily tissue. Oftentimes, this cancer depends on the severity of the tumor, which can sometimes be removed by surgery. This is also the most common type of skin cancer seen in dogs. And last, but certainly not least, is lymphoma. This cancer is derived from the lymphocytes and the lymphoid tissue of the body. Lymphocytes are a type of white blood cell that are responsible for many immune system responses. They undergo a maturation process in the thymus, which is a lymphoid organ located in the dog's neck area. The cancer typically affects lymph nodes, which are smaller aggregates of these cells located throughout the body. Prognosis typically depends on the stage of the disease and the involvement of the cancer. Lymphoma is the most common type of cancer in dogs, accounting for nearly a quarter of all canine cancer, and according to one study done in golden retrievers, neutered males are nearly 3 times more likely to get lymphoma than intact males. So clearly, spays and neuters can lead to an increased risk of a lot of different cancers. And to end the section, I just wanted to take a look at this one study done in 2014 that took a look at over 2,500 Vizslas to look for the correlation between gonadectomy and cancer. The researchers basically sent out a link that was posted on the Vizsla breed website and asked owners to self-report information about their pet's spay/neuter status. The survey also asked about any cancers that the participants' dogs had and fear of storms for some reason. The study suggests that rates of mast cell cancer, hemangiosarcoma, lymphoma, and lymphosarcoma were all increased in the gonadectomized dogs compared to the intact dogs. So the study showcases the hypothesis that there is a positive correlation here. For the next portion of the video, we're going to talk about the other conditions that are correlated to gonadectomy. Looking into conditions other than cancer, you can really see the list start to diversify here. The following compilation is seemingly a random assortment of ailments. However, multiple studies have shown a correlation in each case, so let's investigate. First on the docket is urinary incontinence. We can define this as the leakage of urine due to the loss of the control of the urinary sphincter. Without getting into the suspected cause yet, the interesting thing about this ailment is that it can be treated with hormonal therapy, such as using estrogen. Similarly, urinary calculi is also seen in higher rates in gonadectomized dogs. Urinary calculi refers to solid particles that usually consist of mineral concentrations that form within the urinary tract, which is obviously a bad thing. Some studies suggest that spaying and neutering causes a 3-time increase in the chance of developing urinary calculi. Continuing with the unhealthy trend, we have diabetes mellitus. This is a condition in dogs where the beta cells in the pancreas that produce the hormone insulin are impaired. Insulin lowers blood sugar, so when there is a failure in this production, blood sugar levels rise, leading to a condition that is known as hyperglycemia. This often causes symptoms such as excessive thirst and hunger and weight loss. Unfortunately, diabetes in dogs is on the rise. Another hormonal imbalance correlated with gonadectomy is hypothyroidism. In the healthy dog, the thyroid gland produces thyroxine and triiodothyronine, which are responsible for maintaining a basal metabolic rate. In a dog with hypothyroidism, their metabolism slows, which often leads to weight gain and lethargy. Fortunately, there are medications to help this condition, but it is unfortunate that neutered dogs are 30% more likely to develop hypothyroidism. Next up is hip dysplasia, which is a commonly screened metric, especially in breeding dogs and bitches. This condition involves the laxity of the supporting structures of the hip, causing the erosion and malformation of the articular surface between the acetabulum, aka the socket, and the ball of the femur. Down the line, this leads to osteoarthritis and general limb lameness. Along the same orthopedic lines is the increased rates of cruciate ligament tears in spayed/neutered dogs. The cruciate ligament is an important structure in the dog's stifle joint that is responsible for proper hind limb action and locomotion. Commonly in dogs, this structure tears, leading to lameness and the inability to bear weight on that limb. The effects of this are worsened in dogs that undergo a prepubertal gonadectomy, as this procedure lengthens the time in which bone growth plates close. So this leads to a situation in which there is abnormal conformation of the surrounding bones, which increases the strain experienced by the cruciate ligament. Last but certainly not least is obesity.
I kind of have OCD.
You mean obesity?
This inflammatory condition can exacerbate the previously mentioned ailments, since obesity can put more weight and stress on the bones and joints of our dogs. This can seriously increase the severity of osteoarthritis and other forms of inflammation. Over 2/3 of gonadectomized dogs are obese, so this is probably the most common condition that we will talk about in this video. Hey, this is my cat Hamlet, so obesity is unfortunately very common in American pets. And before you get mad, my dad feeds him. Before we get into the next section, I just wanted to take a quick look at these findings in obesity in dogs. So the study was conducted to find hormonal imbalances in obese dogs, but would you look here, out of one sample, the fixed dogs were more likely to be heavier in weight. Okay, I'm done fat shaming these poor hounds. And that, ladies and gentlemen, wrapped up the list of all the risks of spaying and neutering. So now you may be wondering, what does any of this have in common? Why did I just watch 10 minutes of different ways dogs can be sick with unfunny jokes in between? Well, for those questions, we have to get back into the physiology of gonadectomy, and for that, let me introduce you to the hypothalamic pituitary gonadal axis. So there we just observed the hypothalamic pituitary gonadal axis of a healthy dog. As you can see, there is a negative feedback loop between the hormones, meaning that the end product of testosterone inhibits the production of its precursors, which are GnRH, or gonadotropin-releasing hormone, and LH, also known as luteinizing hormone. Now, in healthy dogs, luteinizing hormone has very important reproductive functions, but let's see what happens once we remove the gonads and thus removing this negative feedback system.
Huh?
So there we saw that without the negative feedback from testosterone, the hypothalamus kept producing GnRH and the pituitary gland kept producing luteinizing hormone. So this led to an increase in the concentration of the circulating luteinizing hormone in the bloodstream. Now, LH has receptors all throughout the body, and when there are these high concentrations in the blood, these receptors can become sensitive to the LH and cause the cancer that we have previously been discussing. So all along, LH has been causing our problem list. Every single condition can be traced back to that forsaken glycoprotein so vital for reproduction. Most every tissue has LH receptor somewhere. The reason why is being looked into and is a novel field of science. But every single tissue we've discussed today, in the prostate, in the urinary tract, in the bones, in the muscle, in the skin, in the lymphoid tissue, in the thymus, in the pancreas, in the thyroid, in the cruciate ligament, in the hip, there are millions of LH receptors waiting for supraphysiologic concentrations of luteinizing hormones to bind to them and cause a cascade of problems. Oh, and a fun fact about the whole obesity thing, it's possible that LH causes lesions to the ventromedial hypothalamus, which is the stop center for appetite. Therefore, LH is making your dogs fat, because why not? Now I feel like Alex Jones. But anyways, looking at our last study, here they conducted a series of time-trialed blood samples and compared the basal levels of LH in the blood in overectomized or spayed bitches to those of intact bitches in anestrus, which means that they weren't in heat. They found that the LH levels in the spayed bitches were higher. This supports the hypothesis that the removal of the gonads also removes the negative feedback loop that would otherwise keep LH production in check. So yeah, fixed dogs are filled with LH that is getting up to activities that it shouldn't be, like causing cancer. So why am I talking about this right now? Well, this information offers a more nuanced approach to deciding whether to spay or neuter your dog or not. You know, past the typical, he's annoying me. Of course, the reasons to spay and neuter are still valid, such as to prevent a disease or avoid accidental pregnancy, but it is important to weigh the pros and cons when you make any decision regarding your pet. Remember, the health of your pet is in your hands. Anyways, thanks for coming to my TED Talk. I hope you enjoyed the video, and let me know in the comments what you want me to cover next. I was thinking about going over the complete Holland lore, but let me know what you guys think. And please consider subscribing to me to help the channel out. It would mean so much to me. And as always, thank you for watching. Bye.